Have you ever been sitting at a stoplight after work, minding your own business? The sun's out, your favorite song's on, and then you hear it. The sound of screeching tires, and the next thing you know, somebody's rear-ended you. Hi, I'm Dr. Putney with Wellington Family Chiropractic, and today I want to talk about things that you should consider if you've ever been in a motor vehicle accident or rear-ended while in your car. The reason why I want to talk about this is because I had a patient recently that came in with chronic neck pain that had been bugging her for about 6 months. And as part of our assessment, we go through a history, things that make it better, things that make it worse. And one of the questions I always ask, have you had any past injuries to your head or neck or motor vehicle accidents? She said that, yeah, 3 years ago I got rear-ended. The person was going about 15 to 20 miles per hour. I was really sore that night. And for about 3 weeks, I was really stiff. But I didn't have to go to the hospital. It wasn't anything like I drove my car home. It wasn't that big of a deal. But the thing is, she's having chronic issues now in the same areas where she was having pain after the accident. So that's why I want to talk about things that you should consider if you're ever rear-ended or you're in an accident. And there's a few things that I always tell my patients that you should do. The first thing to consider is that it can lead to chronic problems if you don't get it treated. Typically what happens in a motor vehicle accident is because we're strapped in, our head gets thrown around. So if you get rear-ended, a lot of times you have what's called a flexion extension injury or whiplash, to where your head gets thrown forward and then comes back. Our necks don't do well, and our spine in general does not do well with that movement that happens with a lot of these car accidents. And a lot of times you can have your head turned looking up at the person, coming to get you, and wham, and we add rotation into that. It can really mess your neck up, and like I said, lead to chronic problems. So you need to consider the fact that, maybe you don't have to go to the hospital. Maybe you're just sore for a few days, but that type of injury has been shown to cause chronic problems in the neck, the upper back, and even sometimes the low back. So that leads me to my next point. Always consider the fact that, at least within the state of Kentucky, you have access to medical care. So build into your car insurance, you have what's called personal injury protection or PIP coverage, and that gives you money set aside to cover medical expenses, so they are not coming out of your pocket. So a lot of people put this off because they're like, well, I don't want to go get assessed, or it wasn't that bad, I didn't need x-rays, so I just dealt with it, because they don't want to take on the expense of taking care of those injuries. Well, typically you have some money built into your car insurance that's going to cover that. So that's very important to consider, at least within the state of Kentucky, is you're protected and you have access to medical care to cover those expenses. The third thing to consider is that you do need to be properly assessed. So if you've been hit from behind or hit from the side and your head's flown this way or that way, like I said, it can lead to chronic problems. If you're having some symptoms, you need to be assessed. So when we have these patients come in, typically we assess them right away. The sooner the better. And we take them through different ranges of motion to assess the extent of the injuries. And then we set up a care plan to get them right where they were before they got injured, and hopefully maybe even a little bit better. And what we use at the office is a combination of spinal manipulation or the adjustments. Those really help in these cases if they're in the right areas. We use soft tissue work or manual therapy, a lot of stretching, deep tissue work on some of those muscles that have been strained. We use dry needling. That helps a lot with patients with these issues. And then we always try to rehabilitate that area. So you need a lot of work after these type of injuries to return to the point that you were before you were ended or in that car accident. And like I said, with the right care plan and structured rehabilitation, a lot of times you can get back there or even be better than you were before, depending on what you have going on. So these are all things to consider. I always tell people, don't wait. This patient never did it. I'll have patients that wait 3 or 4 months and then they get assessed because that pain's not going away like they thought it would. And then it just gets harder to correct. So always consider the fact that if you've been rear-ended, don't wait. You need to be assessed. You have access to care, and it can create chronic pain in those areas, or chronic injuries or problems in those areas. So think about that. If you have ever been in an accident, you get in an accident, you know somebody that's been in one, They need to be assessed and consider these things. So hope this helps, and I'll talk to you guys soon.